Okay, guys, let's start on Unit 3. Unit 3 goes into the roles and responsibilities of a CNA just a little deeper than we have in the past. In the first unit, we talked about what you would be doing. In this unit, it breaks it down. It breaks it down to personal care, right? We already talked about our ADLs. Remember what ADL stands for? I hope so. Activities of daily living. This is toileting, dressing, bathing, grooming, making their bed, picking up their room, um, cueing them to help them to do as much as they can for themselves. You're going to care for their living space. Not only do you have to make sure your resident is clean and neat and well taken care of, you need to take care of their living space. It never fails that the DON and the nurse manager will walk the hall after you have everybody to breakfast just to make sure beds are made, trash is taken out, there's no odors in the rooms, personal items are put away. So not only are you caring for the resident, but you're still responsible for keeping their living space cleaned up and free from any clutter. Um, as far as food service, you will be handing out trays. You'll be setting it up, cutting up their food, buttering their bread, putting jelly on their toast, making sure they have all the drinks they want. You're going to document how much they ate. If they're on INO, which is intake and output, how much liquid they took in. Um, you'll be encouraging them to eat. We'll talk about this more in nutrition unit, but you'll be feeding them. So it's really important that you uh, take care of their living space, because also keeping things picked up and put it out of the way leaves a clear path for walking, and it helps prevent falls. The other thing you're going to be doing is record keeping. Now, in the medical field, we have a saying that says, if it's not documented, it never happened, right? So you need to be documenting the care you give. A lot of times we document if they shower, if they had a bowel movement, if they're on intake and output, we're recording how much goes in and how much comes out. We're documenting behaviors. Um, the Anytime you tell the nurse something, you should document what you reported and then charge nurse notified, right? Because that covers you, that you are telling the nurse if there's something wrong with the resident or something is changed with the resident, because you're going to know those residents a lot more than us nurses know them. Okay. um, you are going to have good communication and teamwork with your coworkers. Uh, it's a lot easier to work with people that are willing to work as a team, or you may deal with people that, I know an aide who's been a CNA for 30 years, and she doesn't ever want students when we're in the nursing home because she wants to do things her way. And she thinks that her way is the only way. So I don't ever put students with her because I know it's not her thing. But it's important when we're working with people, it's easier to do things with two people. It just is. It's scientifically proven. It's easier to do things with two people than doing everything yourself. So it's important you're working as a team. Don't ever be that negative Nancy. Have you ever worked with a negative Nancy? The one that comes in and the whole room, the mood goes down, right? She kind of sets the mood for the whole day. I'm here to tell you that a positive attitude is just as contagious as a negative. So come in with a positive attitude. Communicate with your coworkers. Um, it's important that help each other out. Um, you need to be responsible and dependable. We kind of already talked about this. That's like an ultimate thing. You need to document correctly. Um, you need to be honest. You need to respect other people and treat them with dignity and respect, residents as well as your coworkers. Um, You need to be clean. You need to be well groomed. You need to be in appropriate clothing. I always knew when I started the clinic, I worked with two 23-year-old girls that were in partying city of the part of their life, right? And so I always knew when they didn't come home or didn't go home the night before after partying because their scrubs would be inside out. Now that was okay in the 80s, but it's not real professional this day and age. Always be prepared. Have a couple pens in your pocket. Have a notepad, or a little notebook. Have your gait belt. Always have the equipment you need to do your job. Know that each facility has different policies for dress code. Some places you have to cover tattoos and you can't have different colored hair, or piercings, facial piercings. A lot of places don't like, the eyebrow piercing or nose piercing. You just need to know your policies and procedures at your facility. It's important that you follow their policies and procedures for for attendance, gifts. We can't accept gifts from residents, right? We have to maintain professionalism. Now, the next thing we talk about is HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. It was put into law in 1996. And what it says is that we cannot release a resident's information without written consent that we can tell these people, right? Now, we have to be aware of HIPAA at all times. We have to only discuss stuff with people who are on the HIPAA form. That's why we never, as an aide, give out information, because the nurse is the one who has time to look at the HIPAA form. I always say anything that happens in a facility stays in the facility. Anything happens outside the facility should stay outside of the facility. When you hit that door to go to work, you should be present and accountable for what's going on in the facility. We got to leave everything at the door. Now, I had a surgeon who was great at this. Literally, he could be cussing and throwing computers and charts at the back x-ray table and dropping the F-bomb and everything. But the minute he walked 10 feet to that exam room to see the patients, those patients were the most important thing in his life. We got to learn from that, right? What happens outside the building stays outside of the building. What happens inside of the building stays in the building. That's HIPAA, right? Let's see what's next. Now, in the state of Kansas, there are 3 things you cannot do as a CNA. 1, you cannot give medications without being a certified medication aide in a facility. Now, a lot of the residential facilities like Starkey, Ketch, ResCare, and Newton, these facilities do allow you to take a medication aid class, and they teach you how to give their clients medications. But as far as a long-term care facility, you have to be a certified medication aid, back to Lawrence State Hospital there. The second thing is you can't take doctor's orders. A doctor can't look at you and say, hey, I need to put Joe on a puree diet. That's a nurse's job. There's a lot of note-taking and processing. You need to just say, I'll get you the nurse. The next thing is you cannot give information off the chart. We kind of talked about this just a second ago with HIPAA. You cannot open a person's chart, look them up, and give somebody information off of it. If somebody needs information off the chart, they need to talk to the nurse. Now, that being said, if you're wheeling Joe back from the dining room and his wife asks how he ate, can you tell him? Yeah, it's okay to tell him. Well, he ate about 50%. So remember, those 3 things are going to be really important when you get to taking your state. You cannot give meds. You cannot take doctor's orders. and you cannot release information off the chart.